Well, for an overview of the COVID-19 situation on the African continent, I'm joined now via Skype from the capital of the Republic of Congo, Brazzaville, Dr. Mary Stephen, who's a technical officer at the WHO's Regional Office for Africa. Dr. Mary Stephen, always good to talk to you. Thanks so much for joining us. Welcome to the program.
Thank you, and good evening to your viewers.
All right, so some words of caution from the WHO Director General, Dr. Ghebreyesus. He says that this race is far from over. What's the situation in Africa? Because we got into the race later than the rest of the world.
Yes, the outbreak continues to evolve, even in Africa. And like the DG said, we still have a very long way to go. We still continue to see increasing number of cases on daily basis, even though the situation varies from country to country. But if you put the whole continent together, we are still ascending in terms of the number of cases. So we have not seen our peak yet on the continent. And quite a number of countries, about 10 countries, are still reporting high number of cases.
How will we know when we've reached our peak on the continent? There are concerns that we're not counting adequately.
Yes, there has been concerns with testing, but this is not peculiar to Africa. Globally, testing has been a challenge, and but we know from Africa that quite a number of countries are beginning to expand this testing capacity. They are also decentralizing the testing to the lower levels of health systems, so they are able to test more people that are having COVID-19 at the community level in some of those communities that is not the typical urban areas that we have. Mm-hmm. So yes, it's possible that some cases are being missed because we are not doing community testing, but we do not believe that they are very, very significant, because one thing with outbreak is that even if testing is limited, if people are getting infected in one way or the other, they will report to the hospital, or it will reflect as unknown community death. So in one way or the other, you get to know that something very, very serious is happening that you don't know about. So yes, countries continue to expand their testing capacity, and of course, if you test in the community, the likelihood that you get more cases is also there, depending on the type of transmission pattern that the country is having.
How does one mitigate for this large number of people that are asymptomatic, that perhaps have such mild symptoms that they don't even realize that they've got COVID-19 and perhaps are passing it on, and they get better and never realize that they were carriers of COVID-19? And we believe that this is quite a large number in the incidence of COVID-19 across the world. And that could be a concern, because it's hard to count. They don't go to the hospital. They don't report their test status or their status because they're not testing.
Yes. So for the asymptomatic, yes. If they do not test, it is not likely that they will know they have COVID. But it's likely that they can expose other people, because we know that from the statistics that 80% of cases will be mild, and 15% severe, and 5% critical. And then some of these cases can end up in the health facilities. But yes, if we are not doing community testing, it's difficult to tell if you have an asymptomatic person carrying the COVID out there in the community. But the most important thing that we need to all observe is to make sure that we are observing the preventive measures in terms of the maintaining at least 1 meter physical distance from others, making sure we are washing our hands regularly or using sanitizers, respiratory etiquette, and also wearing the face masks when we go out to the public places, so that even if one is carrying the COVID and this person is asymptomatic, then at least he is not exposing so many people to the risk of contracting the virus.
All right, going back to the DG, saying that this race is far from over, what lessons can we learn from countries like America, where they started easing and all of a sudden you started seeing some regions, particularly in the south, their caseloads starting to rise again? What do we learn from this story in Africa as we start our process of thinking in terms of easing down?
Yes, countries continue to battle between the economy and public health. And of course, the same situation in Africa, even much more, because we have people in the informal sector that may not or are not able to cope with a sustained lockdown. So the need to balance that. But what we can learn is that even if we begin to open, first of all, we have to reopen on gradual basis, reassessing the situation, and where we see potential for increase, it is likely that we might have to go back again and focus on some of those hotspots, maybe lock them down back again to limit the transmission. In addition to that, as we are reopening, we have to reopen safely, meaning that we have to put provision in place for people to be able to observe all the preventive measures, able to wash their hands or use hand sanitizers, making sure that they are keeping the 1 meter distance, wearing their face masks, observing the respiratory etiquette. So not just a government responsibility, but we also have a responsibility as individuals to make sure that we are adhering to these preventive measures if we need to go out.
All right, South Africa has 34% of all the COVID-19 cases on the continent. What's your concern for South Africa as we start to get very close to that peak in the country?
Yes, South Africa is reporting the highest number of cases on the continent, but we also know that the government didn't take it lightly from the beginning. The public health measures were implemented aggressively. Even the lockdown, South Africa was one of the countries that was, very strict in terms of implementing this lockdown. So we know the effort put in place, and we believe that this effort has contributed in reducing further spread, because we could have been in a much more worse situation if nothing was done. So what we need to do is to make sure that we sustain this implementation of public health measures, testing, isolating, treatment, contact tracing, and the public health making sure they observe all the preventive measures as well, and decentralizing these capacities to the lowest level of the health system so that we can pick these cases. For outbreaks, yes, we might have large number of cases, but it is not impossible really to deal with the outbreak. It's just that it will take a lot more time and effort if we have widespread community transmission to get ahead of the virus. But we should remain hopeful and remain focused on the interventions. It's not time to give up. Let's not give up. There is still opportunity to break this chain of transmission.
All right, Dr. Mary Stephen, always good to talk to you. Thanks so much indeed for sharing your insights and your thoughts with us this evening.